I think as a specialty clinic, Southpaws has really separated itself from other specialty clinics in being very orthopedic and sports medicine, rehabilitation oriented. And so really for us, the next logical step was to incorporate regenerative medicine, which is such a huge part of how they treat people with orthopedic and soft tissue injuries. So PRP is also known as platelet-rich plasma. And we all know platelets and their function with clotting, but what a lot of people don't realize is that inside the platelet itself are things called alpha granules, and those alpha granules are loaded with over 250 growth factors. It's those growth factors that help to rev up or stimulate healing in soft tissues or arthritic joints. So yeah, stem cells are pretty amazing too, and all of us have heard about it in the news. We typically will reserve stem cells for really severe cases of osteoarthritis and for soft tissue or ligament injuries like an Achilles tendon tear. With PRP, the process is fairly simple. We draw usually about 60 mils of blood and collect it, and then we put it through a special PRP kit that we have here in-house. And in the end, we end up with 4 to 6 mils of this PRP solution, and then we can divide that up to put it into a joint. One thing that I always warn owners about is that many of these dogs may have, up to 50%, may have what they call a joint flare. And the joint flare is nothing but a positive inflammatory response that occurs in that first 24 to 48 hours. So sometimes they look very stove up and stiff in that first 24, 48 hours. I tell people, don't panic, it'll go away. We have to be sure that we don't use any anti-inflammatories, which is what we want to reach for, because they actually will inhibit that inflammatory response. The companion animal regenerative unit that we use has been validated in dogs and tested so that we know exactly what we're getting. The main principles of PRP especially is we want to have increased platelet levels so that they can release their growth factors, and we want low amounts of neutrophils and red blood cells that can cause cartilage damage and inflammation. One thing that's really important to know is that anytime that we do a stem cell treatment, we always have PRP at the same time. And the reason is that the PRP basically activates those stem cells, and the PRP sticks to the damaged tissues and allows the stem cells to know where they need to go.